Assalamualaikum warahmatullahi wabarakatuh. I would like to say thank you for already give me opportunity to present the result of my segment. Let me introduce myself. My name is Fahrani. I'm from class D1 morning. The purpose of this presentation is to educate about the coronavirus in Indonesia. My presentation this time used Zoom application with my friends, namely Halimatu Sadia Ginting. Okay, I will start it. Assalamualaikum warahmatullahi wabarakatuh. Good morning everyone. My name is Fahrani. Here I will present the result of my assignment regarding the coronavirus or COVID-19. What is COVID-19? COVID-19 is a disease caused by the severe acquired respiratory syndrome coronavirus 2 or SARS-CoV-2. COVID-19 can cause respiratory system disorders ranging from mild symptoms such as flu to lung infection such as pneumonia. Discussion. The first discussion is COVID-19 in Indonesia. The second discussion is prevention. And the third discussion is data. How do you get COVID-19? A person can contract COVID-19 if they come in contact with another person infected with the virus. Someone infected could or sneeze directly to them, and they touch any surface with little droplets from infected people's cough or sneeze, and then touch their eye and your mouth. The first discussion, COVID-19 in Indonesia. When will Indonesia be exposed the coronavirus? On February 14, 2020, uh, uh, 31 years old Indonesia citizen was suspect of contracting the coronavirus while at the restaurant in Jakarta. He contracted it from a Japanese citizen who was also in the same place. The Indonesian citizen and Japanese citizen who live in Malaysia are not known to be close contact. Shocking and worrying news for us in Indonesia has emerged since last Monday, the 2nd of March 2020. At that time, President Joko Widodo announced that there were patients who were positive for the coronavirus and had COVID-19. There were two COVID-19 patients in the first case. This occurred in the country, namely a woman aged 31 years, case 1, and her mother, who, who, who was 64 years old, case 2. According to Jokowi, the coronavirus was avoided from Japanese citizens who had traveled in Indonesia. He then transmitted it the case 1 patient, then the coronavirus reached the case 2 patient. Is there a spread of the coronavirus from the discovery of case? After the discovery of case 1 and case 2, the government continued to care in tracking their activity. Until then, it was suspected that the coronavirus will spread in same location when case I made close contact with Japanese citizen at a restaurant in Seoul, Jakarta. The search was carried out using the clutter method, which is looking for people who are in the same location, namely at the restaurant on February 14, 2020. Case 3 and Case 4 are known to be in the same location as Case 1, and there is a possibility of contracting COVID-19 at the same time. It should be noted that is not yet known whether the, the transmission was direct from a Japanese citizen or from a patient and in case one. The second discussion is COVID-19 prevention. Prevention tips. Number one, wash your hands. Number two, home quarantine. Number three, when leaving the house, you must wear a mask. Number four, the social distancing, maintain social distancing. And number five, keep object and surface clean. And number six, don't touch a nose or mouth. Each person has a different response to COVID-19. Most people who are exposed to the virus will experience mild to moderate symptoms and will recover without the need to be hospitals. Number one, the most common symptoms, fever, diary cold, fatigue. And number two, slightly uncommon symptoms, discomfort and pain, sore throat, diarrhea, conjunctivitis or headache, headache, loss of taste or smell, and rash on the skin or discoloration of the fingers or toes. And three, serious symptoms, difficulty breathing or shortness of breath. Number two, chest pain or pressure in the chest and loss of ability to speak or move. Flood COVID-19 prevention in cases. Number one, wear mask. Number two, check temperature. And number three, social distancing 1 meter. If someone in your home is sick, number one, continue to practice everyday preventive action of usual. And number two, keep the ill person in the spirit from room from other in the household. Number three, if crying for a sick household member, monitor your own healthy too. And number four, keep surface disinfectant and also avoid sharing personal items. Number five, if you become sick, stay in contact with others by a phone or email. Number six, take care of the emotional health of your household members, including yourself. Wash your hands. Number one, 16% alcohol, finger, palm to palm, fingers nail, and then words, trams, and rub until dry, and then disinfectant. Emergency warning signs. Number one, lips or face suddenly turning bluish. Number two, present pressure in the chest. Number three, confusion or inability to wake up. Number four, the difficulty or trouble when breathing. Personal protective equipment. Lab coat or apron or wear it chronically. Number two, surgical mask and respiratory. Number three, AR face protection are such as glasses. And number four, safety gloves are must be worn the first. COVID-19 prevention. Symptoms: high fever, cold, sore throat, and hair chase. Contagion: COVID-19 air contact and objects. Prevention: wash your hand, wear a face mask, avoid contact, and cover your mouth. The third discussion is infection data. Until now, the government seems unable to overcome the transmission of the coronavirus, then took the pandemic has lasted more than 10 months because COVID-19 costs continue to grow. Beside on the data from the COVID-19 handling task force on Wednesday, the 20th of the month January 2021. At, at 12 m, there were an additional 12,568 new cases of COVID-19 in the last 24 hours. This increase has resulted in the number of patients infected with COVID-19 in Indonesia to now reaching 939,928 people. Starting from the announcement on the first case of COVID-19 on March 2, 2020. This information was confirmed by the COVID-19 task force through data received by journalists and Tuesday afternoon. Data can also be accessed via the covid19.go.id page. The patient recovered and died. However, the number of patients who have died due to COVID-19 is still growing. The data also show that there were an additional 2,267 COVID-19 patients who died in the last 24 hours. Until now, the COVID-19 related to toll in Indonesian currently amounts to 26,815 people. With this change in data, there are currently 100 149,1388 activity cases of COVID-19 in Indonesia. Confirmed case in Indonesia is 927,000 and total recovered people from COVID-19 as of January 2021 in Indonesia is 754,000 and total died people from COVID-19 as of January 2021 in Indonesia is 26,500. Okay, guys, this is the end my presentation. Do you have any question?
Of course, I have question for you. Can COVID-19 be transmitted from a person who is asymptomatic?
Okay, I will answer a question from Halima. Your question, can COVID-19 be transmitted from a person who is asymptomatic? Uh, my, my answer is COVID-19 is mainly spread through respiratory, respiratory droplets secreted by someone who is coughing or has other symptoms such as fever or feeling track. Many people who are infected with COVID-19 experience only mild symptoms, especially in the early stage. Therefore, COVID-19 can be transmitted from people who have only mild symptoms, such as a mild cold but feel well. Some reports suggest that people without symptoms can transmit the virus, but it is not yet known how often it occurs. WHO is continuing to review research development on the COVID-19 spring and will share the latest findings. Is there anything you want to ask, Halima?
Of course, there is something I want to ask again.
What is your question?
Is there a vaccine, cure, or treatment for COVID-19?
Okay, I will answer a question from Halima. Although some Western traditional and homemade remedies can relieve and reshoot mild symptoms of COVID-19, there is no proven cure the prevent or COVID-19. WHO does not recommend self-medicating with any medication, including antibiotic, the prevent or cure COVID-19. However, several clinical trials are ongoing on the both Western and traditional medicine. WHO is coordinating vaccine and drug development efforts to prevent and treat COVID-19 and will continue to provide the latest information or clinical field become available. Okay. Um, okay, thank you for your attention. I would like to express my great attitude. Assalamualaikum warahmatullahi wabarakatuh. Okay, guys, that's all my presentation. Sorry if there is a mistake in my speaking, and apologize also to internet connecting is not good. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.